Right now.
And we begin tonight with a question. Is it better to have police officers on hand or to remove them almost entirely from mental health calls? An activist group thinks the city should run two programs side by side to find out.
The city of San Antonio already setting up a new multidisciplinary response team to respond to mental health calls in the downtown area beginning this spring. Police will already be taking a back seat on this MDR team. An officer won't be responding solo. They'll also be with a mental health clinician and a paramedic. But as Garrett Berger tells us, some think that's still too much.
On March 26th, in the midst of what she says was a mental health crisis, Deborah Montez Felder's brother was shot and killed by a San Antonio police officer.
What John needed that morning was experienced, specialized intervention and compassionate care and assistance.
Montez Felder was one of several people today urging members of the Public Safety Committee to consider an alternative responder model for mental health calls, a civilian team that would not include a police officer.
Because if you're going to get police involved, I assure you, you're going to have pretty much the same response.
It's an idea a coalition of groups, including Act for SA, had previously pushed for in place of the MDR team. But since that's going forward anyways, Act for SA's executive director says a smaller coalition at least wants the civilian-focused idea to be run simultaneously. It could handle lower priority calls, she says, calling for police support only in rare cases.
So that way we can compare the two programs, their effectiveness, their evaluations.
Though Councilman Jalen McKee Rodriguez showed support for the idea at today's committee meeting, city staff don't recommend removing law enforcement from mental health calls. Though the deputy city manager suggests it's something they could consider after they see how their MDR team program works out first.
If there's a different way that we should be handling those calls, we're open to it. We just don't feel that it's safe at this point.
And the police chief says the level of officer involvement in these calls will depend on the situation.
We don't want any clinicians, walking into that where it's a violent situation. Our goal is to simply keep everybody safe.
Garrett Berger, KSAT 12 News.